where you can put your stuff. Okay. This monitor divided for 3 levels. Level 1, this is the critical part. Okay, the monitor, because everything can be done here. It's a touch screen. The second part, we call it the blood part. Everything related to the blood, you will find it here. Blood pump, heparin,
Air detector.
no?
Transducer.
Sensor.
Or pressure sensor, or transducer. On artists, that one invasive.
Yeah, in
And also it's auto-loaded.
Mm-mm.
You know what is the difference between here and there? That one, it's more accurate. Here, this is the air. This is where you will put the chamber, for
Yeah,
example,
this
like
chamber
this.
of- yes.
And inside, there is the air detector. Patient clamps, arterial clamp, venous
Venous
clamp.
clamp.
And inside here, you can see there is a black dot. This is the
Blood sensor.
blood sensor. The lower part, it's the fluid part. So the monitor, blood part, fluid part. This one for the acid, for the soft bag. This one for
Disinfection.
bicarb. But for liquid bicarb, no one uses liquid bicarb here. Some developing countries still they cannot afford this, so they put 2 gallons.
Yeah,
Yeah.
One acid.
Yeah.
And even we're mixing
I
also
done
the
this, I
bicarb.
think. Oh, we done this. in
Yeah,
2000.
manual.
We are manually mixing.
So that's mean you're very old.
Yeah, Philippines.
I'm
You know.
joking. Okay.
Jurassic.
Yeah. So yes,
Jurassic.
that's right. This machine designed, even the artist, you can use liquid bicarb, you can use
Powder.
powder, and you can use acid. Even an artist, you can use the what we call it, the other acid on the gallon. And to استخدموا you can use soft bag, and you can use also
Yeah,
gallon.
instead if bags are there and out of supply, you can buy from the Saudi manufacturer and you can put the pickup tube inside. Okay.
Yan na naman.
How to
Wala na
switch
naman.
on? Very easy. Just no need for long press.
Yeah. So,
Please.
keys.
If you now you have to focus on me. If you start or switch on the monitor, don't put anything. Some nurses are faster than the monitor. Immediately. I know there is nurses. They like everything, yeah. If you do like this, you will have system error or
Yeah.
technical error. Now,
That's it,
the
that
machine will do the first part from the function check. It will check the sound, the light, the blood pump, the pressure sensor here. And you can hear the clamps now. Tuck, tuck. So please
That's the one.
look now. Checking the light. So don't put anything now. If you put anything, you will have technical error. Look now. This one will start. Look to the numbers for the pressure sensor, and this clamps will make noise. Network connection failed.
Maganda, maliit lang.
Oo nga eh. Ang bigat. Bigat din.
Huh?
Di ba tinry ko push?
Pero yung ganyan natin,
So, someone said, okay, when do you want me to start putting? When you have this message.
When
When
ready
ready
for
for priming, now you can put, or you can dress the machine. By the way, from starting the machine until you connect your patient, do you know how long do you need for this machine? 8 to 10 minutes.
But it is manual, we have to be there. No? We
Of
cannot
course.
leave it.
Yes,
Mm-mm.
of course. Yeah, you have to be there.
Especially sa
So
lane.
now, we can start dressing the machine. Always remember, if there is anything blinking, that means, hey, press me.
Okay.
Okay? Sometime the dial is when you put the coupling, and we have to consider something. When you prime that machine, you put the venous line down, right? But with this machine, we have to go to the old school.
Yes.
So arterial line should be here.
Dahil.
So, time management is very important,
Manual.
especially very busy area. So immediately when you start the machine, you get this message, you put A, B, acid bicarbonate.
Okay.
Then you start,
Substitute, yes.
okay? Just Abdul Hamid, can you connect this for me? How to do this? Just
Yeah, turn it to one side, sir.
once you turn it to the right side, you will have the option. K2, K3, low calcium. We will program it
Okay.
based on your. See?
Clockwise,
Then?
pull it, yes.
So what is the code?
394.
Huh?
394.
394?
394.
Okay, thank you. Hey. My card the same. Where to put this?
This side,
on the
side,
right
yes,
card.
please.
Here?
Here.
No,
Oh,
the
here,
right
yes.
side itself we can.
I like
The sides.
this. Right, sorry, we put acid on picards. Now we will start pressing the machine. Bloodline, totally different. By the way, this is pediatric, huh? But it's the same.
Okay.
So, before taking the bloodline from here, sometimes this one from the manufacturer, it's like this. When you take it,
It's removed.
خلاص, you can, sorry, thank you. You cannot use it again. So make sure to secure this one very well. And please don't remove the paper stop. Now, what I'm talking about, best practice. If I will leave, it's up to you.
Okay.
Okay, I'll just tell you and demonstrate the best practice for the patient and your safety. This is the best practice, like this, don't
Yeah.
remove.
Mm-mm.
Clamp,
Spike.
أي filter.
Here,
We make your life easy. You can remove. You don't have to hold the time. We paid
yeah, there
money.
is a code, yes. Or you want to take one from there.
Any razor, it's up to you. Question. Heparin line. Pre blood pump or post?
Pre. Pre.
Heparin line.
Yes.
Before the blood pump or after? After.
Ay, kasi di ba Venus tayo nagbibigay?
Because
Yeah,
I don't know about other machine. Because if the heparin line before the blood pump, what is the pressure on the blood pump? Negative.
Mm-mm.
Maybe it will.
By yes.
How to open this? Use it like the gun. Those parts should not be inside. Should be outside. Okay? Clamp. Again, we make your life easy. So not to confuse, just follow the colors
Yeah.
or the lines. So this one will go like this. Now, the arterial patient's bloodline should be inside this channel, okay? How to open the clamps? Just like this. Both. If you open arterial, the venous will be open. So you can do it from here or here. It's up to you. So you can do like this. Put it here. Use your finger. Not like this.
Should be touching the
Don't
sensor.
do like this. Okay? Immediately, guys. infection control. فرح كلمينها. Guys, always remember, even on the other machines, if you open this from here, put it here, especially for this dialyzer, because the pore size, because this is HDX, the pore size, it's big, it will leak normal saline immediately. So remove it from here, put it here. Clamp. Okay. So now we will do same. Sometimes this one it's not well attached. So make sure it's secure. See? How to make it easy? Press A. See? Not too high, not too low. Like this. Clamp. Clamp. To me, when I used to do my round, you will be in trouble if I will find any unclamped line. Really. Safety. Hello. What is your name? Can you help me to do this? The dialyzer. So you will have back pain after 2 years, huh? You don't have to do like this. You just rotate. Protect your back, guys, because you will do this for how many years? Okay? Thank you. Where is the clamp? Where is the cover? Thank you. So everything made for your safety. So you have to utilize it. Don't do like this. خلاص? طيب, anyone? Guys, anyone want to try to put this? Yes.
No, it's wrong.
Yes. Now the detector will not be functional, so you have to
Put all inside. Yes.
Okay, thank you. It's okay. Yes.
Rather than turning the dialyzer upside down.
Of course, it's up to you. So now what we have to do, still the heparin. So you have to connect. Then you have to prime this line manually, 1 ml. Then, look, you cannot put it like this. So press. The wings should be here in between. Push this one inside. Then how to make sure it's secure? See?
Can we use 10 ml syringe?
10 ml is too small for this.
Because sometimes 20 ml is not available.
At least it will be shukran. Do you know Farah? Farah, she is a troublemaker in our company. That's why she brought for us the bloodline. So she saved my life. Thank you, Farah. Okay, so now what do we have to do? What do you think?
Blinking, press.
What to do?
Working.
By default,
50.
because this machine for
Yeah.
pediatrics, for you it will be 100. Okay? For you it will be 100. When you are going to use the machine here, we'll put it 100 ml per minute. I saw some nurses doing priming 200, 250. If they are my nurses, I will send them home immediately. No joke, because priming should be 100 ml per minute. Do you know why? Why we want the priming to be 100? By the way, this is not related to the machine. I'm utilizing the time until priming will get complete. Why the priming should be 100 ml per minute? Why? What is the reason?
To remove all the air and the
Even with 250, you can remove that.
the phase which has is
Yeah, right. First, you have to be gentle with the membrane. Okay, you have to make the membrane ready to receive the blood. Like now, if the hospital or the university director will come, usually we remove those things. صح? Okay, we make the situation better. So when you do priming, we have to do it the right way, very gentle.
Sir, but this machine is
You are right. It's doing 250,
Yeah.
300. Priming there, it's another story.
but we're using the same membrane.
Good. I'm not talking about the membrane. I'm talking about the priming. I will tell you how. Very, very interesting question. Have you noticed something when you do priming there? Why, if one of the line is not well closed, priming cannot pass? I mean, every time, if you are, by the way, if you are using the artist, if you have any alarm during the priming, believe me, 100% you have either the coupling is not well connected, or this one is not well connected, or some of the clamps open. Do you know why? Because the philosophy of priming on artists is totally different. This is the basic priming. There is 3 steps of priming, but no one knows. There is 3 ways of doing priming. First of all, the machine removing air by air. Do you know how? The machine will suck the air from the circuit. That's why if you keep this one losing, it will keep like what you are doing. So air will keep, but don't do this. Blood pump will stop because there is pressure. So the machine there will suck air by air. Then, have you noticed how the blood pump functioning during priming? Clockwise and
Counterclockwise. Yeah.
then the machine will open and close clamps. Do you remember on CRT sometimes if you have air, you kink the venous line, then you open it. You apply pressure, then you open it. So what will happen to the air? That's why the machine or the monitor there increase the blood flow rate. Here, if you need to increase the blood flow rate, more than 100, again, guys, this is best practice. I'm talking about best practice. Not everyone follows best practice. When you can increase more than 100, if you are in a hurry, after the normal saline will reach the drainage bag, yes. But before, no. I've seen a lot of practice. During priming. I know sometimes maybe you will throw your anger on the
No, vibration
This
to
is
remove
مسكين
the-
حرام. Don't throw يعني if no one give you a day off or something. Go and do exercise. So I challenge a lot of nurses without doing this, no single air on the dialyzer. without touching the dialyzer. But when I do it, the correct or the right way. How? When the normal saline will reach here, this is the time to fill the chamber. What is your name? Can you fill the chamber for us, please? I don't know. Do you know this?
Yeah.
Look, she filled it. She just opened. Okay? But to be honest, this is wrong. Sorry about you.
It's okay,
No. Anyway, we are not here to keep pointing. Okay? It's not your mistake, but this is wrong. Or this is not the best practice. The best practice, you can do it from here. Down, up. Someone said, but okay. This is infection control. We want to keep it close. Question, how long it will take? Is it 5 minutes? 7 seconds. No need to do this. I know this it will take 1 second. So, once we fill this one, don't overfill this until the tip of, you can see the normal saline, right? Yes. Okay. Then you have to activate. By the way, all of you are very lucky. During our time, we don't have screen, no message, just light. We have to use our mind. You have to read, you will be in the safe side. So, what's the machine telling us? Can you read for them?
Air detector not activated.
Air detector not
Activated.
complete the sentence,
Press
please.
air detector.
Press
button.
air to activate. Halas, it's activate now. No patient ID because we are not using the system. Dialysis fluid ready. On the artist, you cannot do priming until you connect everything. Here, no. We go back to the old days because this is basic. So, we cannot connect, don't connect the couplings until the line will be green. If it's orange, that means still. So please don't connect until you complete the training. The second point, the priming. The second point, even if this line is green, but you haven't done priming, please don't connect. Because you have first to finish the internal
Filling
part priming, then we will do the external. So once it's green, we connect.
When are we going to add heparin during recirculation of
Okay.
heparin?
What is your name?
Angela. Because here in our
Angela, she is asking a lot of questions. She's giving me hard time, but I like it. I like the question. Different practice, different school. Some hospital, no heparin to be added to the normal saline. No heparin to be added to the normal saline. Some hospital, first bag with heparin, second bag. Some hospital, first bag with heparin, then they connect the patient, but they will not give him bolus. Someone came from UK, someone came from Australia, someone came from Canada. Different practice, different school, different belief. So here, what is your practice?
We will add to the priming.
To the priming? To the first bag? You add
Both.
1,000?
Both. 500 in each.
500 in each one.
Then you start. Okay. Security forces, first bag of heparin,
Second one of
bag.
heparin. Okay.
They need to reduce the load of heparin because they said we will give the heparin. Again, no totally right, no totally wrong. So don't think they are wrong. They should not think that you are.
So it depends on the hospital policy.
Yeah. If you read on the practice, you will find a lot of, but it's very interesting.
So there is no recommendation from your side according to policy?
No, I cannot because maybe Dr. Khnezi, he's going with this school. Sorry, Dr. هويش.
Okay.
John Hopkins Aramco, Dr. Khanezi, he is following the other.
When we were using the AK200S, we have the recirculation cap. After priming, we used to recirculate
We have
for
it
10
that
minutes.
But it's not with this.
Ah,
this
okay. That
bloodline.
means
With the adults, you will find it.
adult there is recirculation gap.
That one is separate from
You
the
have to buy
package.
from there.
I think.
It's separate
I'm not sure I know.
package. It's separate package.
Okay?
Yeah.
So now,
We will connect the couplings and we will.
yes, we can connect the couplings. But before I connect the couplings, by the way, during the priming, okay, during the priming, if you stop the blood pump, you will have options. Do you want to continue priming? Do you want to stop the patient? Do you want to do?
Recirculation.
It's up to you. So for me, I stop the priming because I consume, so I need to do. So what I will press? Continue priming. So that is it ready. The machine wants us to do the couplings, but I need first to finish from the priming. Look, I haven't touched the dialyzer, right? Since I start priming. On the last part from the priming, guys, even with artists, on the last 2 minutes from the priming, this is the good time to tap the dialyzer. Try to do it this afternoon. I challenge all of you, don't touch the dialyzer. On the last 2 minutes, okay, just do like this. 1, 2, 3. Where is that?
Okay. Okay.
See? Because we done it. Don't keep.
Actually, we are not tapping the.
You will have
dialyzer.
carpal syndrome maybe.
Only
Yalla?
we are removing the air from the
No,
filter.
I need one from the guys.
Nice.
What's your name? Max. I like your name. Can you connect for us the couplings, please? Sean? Sean? Sean?
Sham.
خلاص. Very nice. Then we have to press. Look what will happen. Now when you press,
The dialysate free flow from yes.
it's filling. Now you can start the session. By the way, now because I keep explaining, if I do it as I will prepare it for the patient, it will not take more than 7 minutes. So I'm sure you will like it because it's saving your time. Let's do the prescription now.
For
You press
hours.
from here.
Okay.
You press here. Therapy time 1 hour. I need to remove 2 liters. Then, like the artist, you can see here the navigation pad. صح? On the artist. You
Yeah.
can go to the blood menu.
Yeah, yeah.
We make it for you here.
The lower portion. Okay.
Blood menu, fluid menu, disinfection, function. Can someone answer like what on the artist? What is matching the function on artist? Something similar.
Clean
What we call
screen.
it?
Clean screen.
No, what we
Rinse
call that
bag.
option.
Hygiene. No.
No.
Clean. No. Artist.
Something on the main screen here in the artist. Function, it can let you to do post therapy, change the blood line.
Okay, the special
Special
procedure,
yes, special
Special
procedure,
procedure. Here it's function. Function like the waiter in the restaurant. What do you want?
To recirculate or to
So
change
here,
the screen.
if you press function, post therapy, change the blood line,
Rinse
rinse
back.
back, it's mean
Terminate the
termination. But here, if you press rinse back, the machine will ask you to confirm. So the machine will ask you, can you put the remaining therapy time 0? That means I acknowledge
Yeah, I
It's
have to
ended.
really to respond. Okay.
Night lights, if you are doing inpatient during the night, you need to watch Netflix, switch off the light. Don't think at them. Okay? Arterial pressure, venous pressure. If you press, you can control the window. You don't need to control the window because this machine, like the artist,
Automatically do that.
yes. If you need to fix something for the patient, fistula,
Then we will
you
widen it.
can.
Yes. Expand it, then we will correct it.
Why do you need to expand?
So it will not alarm. It will not hit the
Why do you avoid alarm?
Each
It
time
will
it
not
will
stop.
alarm, it will, no, the blood pump will be stopped each time it will be
Why?
alarmed.
What else? To avoid clotting. What else? Frequent.
Infections in the
It will affect.
The clearance.
clearance.
So arterial line, venous line, they scan here. Blood pressure monitor system. If you press here,
You can change the
look to the
interval.
heart.
Ah,
Now
okay.
it's checking.
How can we change the interval of the blood pressure reading? How can we change the intervals? For
Okay,
example, from
okay.
34.
BP, then
So
there
it's
will
there.
be
It will be there.
I want it to be every 30 minutes.
Okay.
Then activate. You need to play with the alarm. You can play here. Okay?
blood flow.
Here.
Yeah, this is the negative part of the
Yeah.
Same. The scan, Watson formula, interparameters, male.
like our old one, male, female,
the KT over B.
Yes.
Okay? Then you activate. Alright? This is the blood pump speed. This is the accumulated blood. How many liters of blood was cleared? Accumulated heparin. How many mLs of heparin was
Delivered.
accumulated ultrafiltration? There is small number. This is your target. The big number, how much removed? Yes, until now. And this is the UF3.
Our yes.
If you go to the fluid menu,
Your
the first one for the ultrafiltration, profiling, isolated UF.
Okay.
Again, where?
Conductivity.
From
Fluid,
where?
fluid. This fluid.
If you need to
from
change,
here.
Fluid.
hello doctor. زين
ها كيف الامور؟
لا الحمد
يلا ان شاء الله جامبرو يلا خير ان شاء الله ان شاء الله.
لله بكره ان شاء الله temperature, sodium bicarbonate, what is the dialysate flow rate, and so everything on the fluid related to the dialysate temperature, the potassium, the sodium, the bicarbonate. What about the blood menu? You have the heparin because it's heparin related to the blood. What is the, let's say I'll give the patient 2 ml as a bolus, then I'll give him 1 ml hourly, stop time 30 minutes.
Are there any other options for administering heparin, like continuous, linear,
No.
or intermittent?
No, it's
or
linear.
only linear.
Not like that.
So no intermittent.
Yeah.
Oh, okay.
Blood flow, this is very
Linear.
important to all of you. Tomorrow, if I will use this machine, inshallah tomorrow we'll do patient connected, right? We will do the morning. The next patient. خلاص, good. Okay. For example, like in John Hopkins Aramco, this machine to be used for adult and pediatric. For the safety of the patients, we program the default setting to be for pediatric. So if I use it for adult, nothing will happen. But if I keep the default adult, then I connect it by mistake. So tomorrow, I have to change the blood segment. This is neonate. 3 neonates, 6 pediatric, 8 adults. So tomorrow I'll select the blood segment 8 because I will use. Once we dialyze the patient, therapy completed. After disinfection, it will go back to the default setting. So it will go back to,
So every...
yes, to pediatric.
So every
Okay? So now, for example, everything is ready, I will connect the patient. What is your style here? You do both? Connection or you bleed the patient?
Bleed.
Malas. This is our patient. For example, this is the patient, right? So we connect arterial line. But don't do like this to your patient, huh?
Ha? Di ba ginagawa natin air? Walang air sa kabulan.
Okay? So we connect our patient. Then what we'll do, we press connect patient. When patient is connected, then again by default, because this is pediatric, tomorrow it will be 100. For example, 100. But I have a lot of air here.
Yeah.
Okay, guys, so we started the blood pump. That means the patient already connected. So the blood will come from the patient to the blood pump to the dialyzer. After dialyzer, it will come here. We have a lot of air now. But it's okay. So once the blood will reach the blood
Sensor.
or detector, what will happen? What will happen to the blood pump? Automatically it will stop, even if you are not around. And what you have to do, you have to just read. But now, if we spend 5 years, nothing will happen because there is no blood, because this is not saline. So what I will do? Make it dark. So again, here I'm talking about AK98 and artists. Please don't start the ultrafiltration immediately. I know what is the practice. You start ultrafiltration, then you start the blood pump, then you keep increasing. Wait until you reach the target blood flow rate, then you stop here to avoid pressure change inside the filter. So start. For example, our then you can start. Look, guys, what's written here? Heparin. It's blinking. That means the machine now delivering the heparin. The scan here. That means the scan is activated. If I switch off the scan. Off. No more desk. So like the artist, you can see in the top, here you can see it. If you do isolated UF profiling, it will be here.
So instead of 20 cc, we can use 10 cc.
10 cc, very risky to be used here because the wing here is very big. Take, yes, okay. So now the therapy already started. We started the therapy. So again, when you compare this to artists, very easy, very straightforward. Just you have to read the instruction. For example, I want to change the potassium bath for my patients. Can you show them how to do this, please? Can you change the
I want to
the
change
soft
the
bag? Concentrate.
mm,
First, you have to
and
select.
then concentrate.
Then you press.
Concentrate.
Then
The options.
you select based on the. Okay, guys, how to change the temperature? I want the temperature to be 36.
Same, the fluid.
Yes. Yes. 36. Either you type 36 or you can do. Okay. Can you stop the heparin?
Blood in the
Close.
body stop time. What do you want to do?
He received already the bolus. I don't want to give him the hourly.
Hourly. So flow rate I will keep it 0, 0.
Yes. Look, heparin disappeared. It was here. Okay. Any question before I will do the termination? Because what I will do now,
Okay. Once patient is on dialysis, we will
of course, but now because we were
Okay.
removing there, but definitely
please with the after first patient.
heat, end of the day,
Wala na, exam ko lang yung patient kunyari yan.
heat, heat.
Ano?
For us, heat, see, then heat.
No,
No, ano ba?
So heat, then
Hindi pa naman siya i-see na pareho may sa.
always see the last.
Hindi ba nag-i-air nga tayo muna?
see and
Di ba
Why?
nag-i-air
Do you know
tayo?
why? We don't want the machine to
Kasi
speak.
may house,
Yeah,
eh.
that's why sometimes
Pasyente
they
nga
have
lang to.
Ito artery yan.
conductivity. So the
Tatanggal ka.
last,
Saan mo
for
ilalagay
example,
yung salay na galing?
Ganun lang din. Ang salay
no
nandito
second
oh.
shift.
Wala naman yung
Okay.
salay kasi pasyente
So
yan.
after
Ang
the
salay
first
mo lang
shift,
nandito.
I will do heat plus
Wala yan.
Yung Venus na yan.
because this machine will be
Wala.
used.
Venus, pag
Imagine,
nabangka.
wala ito.
Here, I have
Pasyente
three
to.
shifts.
Ito, yung line, yung ganyan.
Ay, di sa...
Always heat.
Di ba? Ito na sa pasyente. Kasi
Okay,
nire-return
you
mo eh.
start with A,
Ha?
Nire-return mo siya sa pasyente. Nakakonect yan sa
and
pasyente.
the last shift it will be
Together, arterial and Venus.
Ay,
Always
naku.
heat
Bulit na nga.
should be the last.
So tayo nga. Air nga tayo.
Oo.
Ibibilid
Always,
natin. Tapos saka
good.
isasalay natin. Yung salay
Shall I
natin
do
nandito. Oh.
patient
Parang
termination?
ganun lang sa dati.
Huh? Patient termination?
Um,
Only 2 minutes.
just tips to troubleshoot TMP. High TMP,
not
low
now.
TMP.
I have another
Later.
session for this.
Okay.
So, how to end the therapy?